Lights out.
Welcome everyone for another exciting episode of SleepTech Talk, the sleep podcast. And those of you who have been with us, you may have noticed we've taken a little hiatus. We were on multiple stages of vacation. The three hosts, we've been on and off. As all of you know, it is vacation season. We thank you for sticking with us. We appreciate the subscriptions, the likes, the comments, and we look forward to bringing more content. And with that being said, let me toss it over to Robert, who's going to tell us a little bit more about our fantastic guest this week. Robert.
Hey, Jerry, thank you so much. Thank you, everyone, for joining us for the podcast today. We're super excited to have with us Tim Safley with ACHC. It's an accrediting organization for home care companies, pharmacies, and sleep labs. Maybe some of you are ACHC accredited. Maybe you have not ever heard of ACHC, but you're going to learn about them today and what a great company they are and how they're able to help their partner organizations from an accreditation standpoint. And I think that you'll find Tim to be an engaging person and also an incredible resource when it comes to all things related to our industry. So we welcome Tim, and we just love for you to tell us a little bit about yourself, how you got started into all of this sort of craziness that you're involved with now, and also tell us a little bit about ACHC as well.
Fantastic. Thanks a lot. I am very delighted to be here, and I always like talking about the sleep industry itself. You know, I started as a respiratory therapist back in the 80s. We won't say exact the date, but I will tell you my first CPAP machine that I set up was an IPPB machine. So that kind of tells you how long I've been there. And it was interesting. Seeing the first, second, third, now 20th generation of different CPAP machines out there today, especially doing the sleep studies and people coming to me, sleep physicians. Well, pulmonologists and neurologists coming to me and said, I got this thing, I want to send home. How do I go about doing it? I mean,
hey, Tim, by the way, that was just before trach was the treatment for sleep apnea.
Well, there is some merit to that statement, that's for sure. So anyway, that's how I got started in the sleep industry. I was a respiratory therapist, well, still am a respiratory therapist at that time in practice. I ventured away from that a little bit and went on to the home care market, where I was a regional VP of Pediatric and Adult Services of America, stayed there for many years, and then went on to help write and start our first standards for DME accreditation at ACHC. ACHC, for the people who don't know us, please visit our website, achc.org, because over the past 3 or 4 years now, not only do we do all types of accreditation, but we also do hospital accreditation as well. So we've ventured all the way from when I started, whether we were doing home health and DME, and they had like 4 or 5 companies accredited to us, to where we are today with all sorts of different services and programs out there. Sleep actually is very interesting. I always say that because out of all of my accreditations, sleep is the most interesting one, because actually, if you look at the thing of sleep medicine, it's one of the newest parts of what, sleep medicine, although you think, well, it's 30 years old, it is. But if you look at other parts of things that we do, it's relatively young. And when we started our sleep lab accreditation in 2009, it's when we released our first standards. Some of the things that we had to do is what makes us a little different. There aren't many sleep accreditors out there. So one of the things I wanted to do as a sleep professional myself is to make the process of accreditation about the lab itself, and about the customers that we treat and about the patients that we treat. Going in for a sleep study, they're there because they're having trauma. They can't sleep. And they have comorbidities associated with them. And it was so important to get into that lab and to feel better. And I think I wanted to build accreditation like I owned the lab. If I own the lab, or if I'm there getting the lab, what do I want to do? How do I want to make accreditation work? And one of the things we did was I said, okay, first thing I got to do is relax the patient and give the physician the information needed to actually do the diagnosis and treatment. So actually, that's how our standards were have been designed. We've improved them over the years, and we have several sleep experts that we contract with and some full-time on our staff that actually make this better. One of the last things that I'll say for our turnover questions is that, it's interesting with the pandemic because now originally we had over 700 labs accredited with us, which is a pretty good number of labs if you take a look at it. During the pandemic, it dropped down significantly because most of these labs closed. I won't say most of them, but many of them, or they didn't do any studies at all. And we've seen so many different models come back out of the pandemic, and now we're back up. We lost almost 200 labs, believe it or not, during the pandemic, but now we're back up to where we started. They're starting to open up, and they're starting to come up with new ideas, new ways to treat. The whole thing of sleep medicine is changing, and we're watching the labs and people in the sleep industry be very creative. So that's kind of where I am now and how we got here.
Tim, that's very interesting what you just said about the creativity and innovation that came about through the pandemic. Could you talk a little bit more about that and how it's affecting the parameters and such that you guys work with as an accrediting entity?
Okay, so let's talk about just the accreditation part of it first before the parameters. One of the things we had to do is we always went on site. It was important to see and interact. Now we've actually, because of technology such as this, such as the different ones, we're doing virtuals. We can do virtual. Now we're always going to go to the lab at some point or another, but we can do virtual surveys. We can have people download, take a look at all the way the education. One of the things our standards did was we needed to meet, and if y'all have been in the industry as long as I have, you've seen all these LCDs and payers come up and say, hey, we need to combat fraud and abuse. So one of the things we also do is take a look to make sure you're meeting the LCD requirements, the requirements of payers. So some of the innovative things we've done, not only virtual surveys, but also workshops. We have ongoing workshops of what's going on. We have podcasts, more webinar type things where instructions on sleep, like infection control in the sleep lab. How do you start a sleep lab? What's going on with the STAR clause in the sleep lab? And we have different guest speakers as well as our own expertise. Some attorneys come in to talk about what's going on with that. And in follow up to your second part of your question, the innovation, we're seeing a lot more, as we already know, back when I started, it was home sleep testing. Now it's a HSAT, so the acronyms changed. And so is the technology. We're seeing some of the rural hospitals that are out there today moving away from in-lab, and they're going to do the screening with hospitals. So the hospitals are going to do it. They will contract out, but now they're going to do HSATs for the hospital. And if they need more information or they're finding it after they're doing it, they can refer them to an in-lab study. So we're seeing combinations of that. And we've seen a huge growth, not only in the US, but we are international as well. And our whole program, we have many accreditation programs, pharmacy, home health, that are international. So we see that coming out, and we've started to develop different standards to meet all those different needs from all the different payers that are out there, right? Because every payer has a different need, and every patient has a different need. And there are a lot of devices out there as well.
Tim, you mentioned payers a couple of times now, and I think that's a really unique way to approach your accreditation process. Our audience is made up of quite a cross section of technologists, but I would imagine for those that have not worked with your organization before, maybe the question is why? What about ACHC is different from my other option? And what is my benefit of maybe utilizing you guys rather than the other option they might have to have accreditation?
So I think there's several of them. One of them is that when we go in there, and I really can just talk about us, that's what I really want to do. But one of the things we take a look at is, it's about educating the lab how to be better. It's not about what they're doing wrong. It's not about dinging them for something else. We're there to help educate the lab. Not only we're finding we're finding that that is the nicest part about our accreditation, what we hear most about, because, well, you missed this, well, you missed this. No, it's not what you missed, but what are you doing to helping the patient? How can you improve our performance improvement process? And also, are you meeting the demands of the payers? Because nobody likes to come in and have a payer recoup money, right? Whether it's Medicare, whether it's and so we look at their standards too, and we are a validation of their standards as well as ours. So I think that's the biggest part. And the physician is a leading part of sleep accreditation. You have to have it, but so are the techs, so is every aspect of that sleep study. And when I went in to start developing these programs, it was about how is a sleep study administered to put the patient at ease, to give the patient the education needed, and to meet the payer's needs of when I'm going to go back to fraud and abuse, right? Because one of the things that you look at is some of the OIG reports of labs, and there used to be a lot more in the industry. We don't see it as much anymore, but we want to make sure that they're meeting the minimum standards. Many labs go far above our standards, but the minimum standards so they can meet the payers straightforward. And say, hey, we do this, we audit it, and we help audit that for them.
Hey, Tim, I love all of this. I do have a question for you. I actually was a little bit surprised. I know you do some continuing education and some of those kind of things, but I even for myself, I'm not sure that I'm as familiar with it as I would like to be. But sort of, can you tell us, I guess, how our audience can access those types of resources? And then I have a second question for you that's not related to the first, and that is, you talk about the importance of the sleep tech, and one of the things that we have spent a lot of time talking about on this show is, the role of the clinical sleep educator, and maybe where you see some changes happening in the future as it relates to ACHC accreditation and the role of the sleep tech as the industry evolves. Because you mentioned it earlier that there certainly has been a lot of changes that have happened because of COVID.
Okay, so I hope I can remember both those questions. So, so that being stated, the first one is we have a division that is we have a division that's called ACHCU. It's an organization that actually is a university where you can go on, where you can get CEs from it. Many of our customers, that's part of what they do. It's a learning module that you can go on. So that's one part of it. Number two is we do, instead of podcasts, and we've done some of these, but we do webinars, and we send them out to our database. And this can be an accredited company by us or a non-accredited company by us. And everybody can access me at tsafley@achc.org, or just go to ACHC. That's easy to remember. And go in there and look for the education. And we have about 4 or 5 sleep infection control in the sleep lab, Stark Law in the sleep lab. And I would tell you under sleep, but we also have them under DME, home health, hospital. But if you do that under DME, you'll see a lot of sleep related stuff too, because usually they go hand in hand, right? One way or another. And we are a deeming authority for DME as well. So that's where you can access that resource, and you do not have to be accredited. They don't charge you anything to do them. It's all about the importance of promoting the sleep industry to do the right thing. And I think part of this, we're not a membership organization. We are just an accreditor. And the second part, I knew I was going to forget it. What was the second part? Because I knew I was going to forget that.
That's all right. It's sort of as you see things evolving and changing, what do you feel like the role of the sleep tech looks like in the future? We know there's a lot of emphasis now to, for sleep techs to get higher levels of education. Their clinical sleep educator, CCSH. There's all of this sort of additional testing, even pediatric, credentialing now. How do you see that sort of playing into the evolving world of accreditation and sleep labs in the future?
So I think it's going to be essential, and I'll tell you why. One of the things I've learned getting into the industry is the sleep techs that have been there, sleep techs that are very, very diligent about their job. they can educate not only me, but the physicians. And I say not only me because I've been doing it for so long, but their education is so critical. Well, if you look at what's happening, now I'm a respiratory therapist by trade. Now we have the ability in some states that we can go and, be like a PA or a registered nurse, a nurse practitioner, and we can write scripts in some states. We've seen that happen to pharmacists. Well, I think that can happen for the sleep tech, but you do need the more education with it, more healthcare education. I think that's going to be essential. And remember, we're getting more and more specialized in our industry today. We've gone from labs, and now many insurance companies use the apnea testing at home, right? To see if they have it, just to screen them to get back into the labs. And I see that continuing and probably increasing because the technology is getting better. But nothing's going to replace the lab in my foreseen future. The reason being is because those comorbidities associated with it, the parasomnias, all the stuff that we are aware of, that in lab and that tech of observation and that tech setting up the equipment is so much more important now, especially as technology gets more advanced. It's really interesting. When I used to do a lot of lectures with the with many of the associations for sleep, they were like starving for more information to improve it. And I think that's where it's got to start. And physicians have started to do more and more of that, which is very positive too. One of our standards is that, you need to have ongoing education from the physician. Now it could be, they said you need to read this and take a test with it. It's not extremely complicated, but it's that interaction between the physician and the techs that helps improve us every single day.
Hey, Tim, thank you so much. This is really interesting. I especially appreciate the points about the sleep tech, the role of sleep tech, and how important they are. You stressed over and over about the cruciality of them in this field and continuing the education. But we are running out of time, and thank you so much for joining us. Is there anything, any last points you want to add before we close?
Yeah, I think if you don't know about ACHC, please reach out to us. Give me a call. Give our sleep specialist. We have like 2 of them here. Actually, I have 3 of them here. Give us a call to talk about how we can meet your needs. Because you know what, you need to choose the right provider, and you need to choose a lab that can help you become better, or accreditor to help your lab become better. So reach out to us. We might not fit your needs. I get that. That's okay. But we are here to help you become better. So please don't hesitate to reach out, learn more about us. And if you don't know about us, or call a customer that's accredited by us and see how it went.
Tim, thank you so much for that. And thank you so much for joining us. And for our audience out there that are watching us on YouTube and or listening to us on the multiple streaming platforms, podcast platforms, we thank you so much for your support. Thank you so much for all the thumbs ups, the likes, the comments. Don't forget to share it with your friends. We'll love you even more for that. And until next time, we want to say lights on.